Tension headaches are among the most common types of headaches experienced by people worldwide. They can affect anyone, regardless of age or background, and often present with a range of recognizable symptoms. In this video, we'll explore the most common signs and symptoms associated with tension headaches, helping you better understand what to look out for. By recognizing these symptoms early, you can take steps to manage and reduce the discomfort they cause. Let's begin by understanding what exactly a tension headache is and how it typically manifests. A tension headache is characterized by a dull, aching pain that usually affects both sides of the head. Unlike migraines, tension headaches do not typically cause visual disturbances or nausea. Instead, the pain is often described as a constant pressure or tightness, much like having a band wrapped around your head. Understanding this basic definition sets the stage for identifying the specific symptoms that are most commonly reported by those who experience tension headaches. One of the hallmark symptoms of a tension headache is a dull, aching pain in the head. This pain is usually mild to moderate in intensity and tends to be persistent rather than throbbing. People often describe it as a steady ache that doesn't pulsate or intensify with physical activity. The discomfort can last for a few hours or even several days, making it a significant source of frustration for those affected. Another common symptom is a sensation of pressure or tightness around the forehead or the sides and back of the head. Many people compare this feeling to having a tight band or vice squeezing their head. This pressure is usually constant and can make it difficult to concentrate or relax. The sensation may be more noticeable during stressful situations or after long periods of mental exertion. Unlike some other types of headaches that affect only one side, tension headaches typically cause pain on both sides of the head. This bilateral pain is a key feature that helps distinguish tension headaches from migraines or cluster headaches. The discomfort is usually evenly distributed, making the entire head feel heavy or sore. People with tension headaches often report tenderness in the scalp, neck, and shoulder muscles. This sensitivity can make it uncomfortable to touch or move these areas. The muscles may feel tight or knotted, and gentle pressure can sometimes increase the pain. This muscle tenderness is a common companion to the head pain and can contribute to the overall feeling of discomfort. A distinguishing feature of tension headaches is the absence of nausea or vomiting, which are common in migraines. While the pain can be uncomfortable and persistent, it usually does not cause stomach upset. This difference is important for identifying the type of headache you may be experiencing and can help guide appropriate treatment options. Unlike migraines, tension headaches typically do not cause sensitivity to light photophobia or sound phonophobia. People with tension headaches can usually continue their daily activities without needing to retreat to a dark, quiet room. This lack of sensory sensitivity is another key factor that helps differentiate tension headaches from other types. Tension headaches often develop gradually, with pain building up slowly over time. Unlike cluster headaches or migraines, which can start suddenly and intensely, tension headaches may begin as a mild discomfort and slowly intensify. This gradual onset can make it harder to pinpoint exactly when the headache started, but it's a typical pattern for this type of headache. The pain from a tension headache is usually described as mild to moderate in intensity. It's uncomfortable and can interfere with daily activities, but it rarely becomes severe enough to be disabling. Most people are able to continue working or going about their routines, even if the headache is bothersome. For many people, tension, headache, pain tends to worsen as the day goes on. Stress, fatigue, and prolonged periods of concentration can all contribute to increasing discomfort. By evening, the pain may feel more pronounced, especially after a long day at work or school. Recognizing this pattern can help you identify triggers and manage symptoms more effectively. Tension headaches can make it difficult to focus on tasks or concentrate for extended periods. The persistent pain and pressure can be distracting, leading to reduced productivity at work or school. This symptom is particularly noticeable during activities that require mental effort, such as reading, studying, or problem solving. Living with a tension headache can affect your mood, making you feel more irritable or short-tempered than usual. The ongoing discomfort can lead to frustration, impatience, or even sadness. These mood changes are a natural response to persistent pain and can impact your interactions with others. Tension headaches can sometimes interfere with your ability to fall asleep or stay asleep. The persistent ache and muscle tension may keep you awake at night, leading to poor sleep quality. Over time, lack of restful sleep can make headaches worse, creating a cycle that's hard to break. Muscle tightness in the neck and shoulders is a frequent companion to tension headaches. This tightness can feel like stiffness or knots in the muscles, sometimes making it uncomfortable to move your head or shoulders. Stretching or massaging these areas may provide temporary relief, but the tension often returns. While tension headaches do not typically cause severe sensitivity to sound, some people may notice a mild increase in noise sensitivity. Loud or persistent noises can become more bothersome than usual, though not to the extent seen with migraines. This mild sensitivity can add to the overall discomfort. A sensation of heaviness or fullness in the head is another common symptom of tension headaches. This feeling can make your head feel weighed down, adding to the overall sense of discomfort. The heaviness is usually most noticeable during periods of stress or fatigue. Unlike migraines, tension headaches do not usually get worse with physical activity. You can often continue with your daily routine, including exercise, without the pain intensifying. This is an important distinction that helps differentiate tension headaches from other types. Tension headaches are not associated with aura or visual disturbances, which are common in migraines. You won't experience flashing lights, blind spots, or zigzag patterns before or during a tension headache. This absence of visual symptoms is another clue that helps identify the type of headache you're experiencing. Some people with tension headaches may notice a mild sensitivity to strong smells, such as perfumes or cleaning products. While not as pronounced as in migraines, these odors can sometimes make the headache feel worse or more noticeable. A classic description of tension headache pain is that it feels like a tight band is wrapped around the head. This band-like sensation is usually steady and persistent, contributing to the overall discomfort. It's a helpful way to describe the pain to healthcare providers. The pain from a tension headache can sometimes spread from the head down into the neck. This extension of discomfort is often due to muscle tension and can make it harder to move your head freely. Stretching or applying heat may help relieve some of this tension. Tension headaches are not typically described as throbbing or pulsating. Instead, the pain is steady and constant. This is another way to distinguish tension headaches from migraines, which often have a throbbing quality. Tension headaches can occur occasionally, episodic, or be present most days, chronic. Episodic tension headaches happen less than 15 days a month, while chronic tension headaches occur more frequently. Understanding this pattern can help you and your healthcare provider determine the best approach to management. Many people with tension headaches notice that the pain is milder in the morning and worsens as the day progresses. This pattern is often linked to stress and muscle tension building up throughout the day. Recognizing this trend can help you plan activities and manage symptoms. Tension headaches do not cause neurological symptoms such as weakness, numbness, or difficulty speaking. If you experience these symptoms, it's important to seek medical attention, as they may indicate a more serious condition. The absence of neurological signs is a reassuring feature of tension headaches. Taking a break, resting in a quiet environment, or practicing relaxation techniques can sometimes help relieve the pain of a tension headache. Unlike migraines, which often require complete darkness and silence, tension headaches may improve with simple rest and stress reduction. Physical movement, such as walking or climbing stairs, does not usually make tension headache pain worse. This is in contrast to migraines, where activity can intensify the pain. Being able to move around without worsening symptoms is a helpful clue in identifying tension headaches. Stress is a common trigger for tension headaches. Emotional or mental strain, anxiety, or even long hours at work can set off a headache. Learning to manage stress through relaxation, exercise, or mindfulness can help reduce the frequency and severity of tension headaches. Sitting or standing with poor posture, especially for long periods, can contribute to tension headaches. Slouching or hunching over a desk can strain neck and shoulder muscles, leading to pain. Paying attention to posture and taking breaks to stretch can help prevent headaches. Spending long hours staring at screens or reading without breaks can cause eye strain, which may trigger or worsen tension headaches. Adjusting screen brightness, taking regular breaks, and practicing the 20-20-20 rule can help reduce eye strain and prevent headaches. Fatigue and lack of sleep are common triggers for tension headaches. When you're tired, your body is more susceptible to pain and muscle tension. Prioritizing rest and maintaining a regular sleep schedule can help reduce the likelihood of developing tension headaches. Skipping meals or going too long without eating can also trigger tension headaches. Low blood sugar can increase muscle tension and sensitivity to pain. Eating regular, balanced meals can help prevent headaches caused by hunger. Not drinking enough water can lead to dehydration, which is another potential trigger for tension headaches. Staying hydrated throughout the day is a simple and effective way to reduce your risk of developing headaches. If you regularly consume caffeine and suddenly stop, you may experience withdrawal headaches, which can resemble tension headaches. Gradually reducing caffeine intake, rather than quitting abruptly, can help minimize this risk. Clenching your jaw or grinding your teeth, especially during sleep, can contribute to tension headaches. This habit puts extra strain on the muscles around the head and neck. Using a mouthguard or practicing relaxation techniques can help reduce jaw tension and prevent headaches. Although not as common as in migraines, exposure to bright or flickering lights can sometimes trigger or worsen tension headaches. Wearing sunglasses or adjusting lighting can help minimize this trigger. Some people notice that changes in weather, such as shifts in temperature or humidity, can trigger tension headaches. While the exact reason is unclear, being aware of this pattern can help you anticipate and manage symptoms. Hormonal fluctuations, such as those that occur during menstruation, pregnancy, or menopause, can sometimes trigger tension headaches. Tracking your symptoms in relation to hormonal changes can help you and your healthcare provider identify patterns and develop strategies for relief. Strong odors, such as perfumes, smoke, or chemicals, can sometimes trigger or worsen tension headaches. Avoiding these triggers when possible can help reduce the frequency and severity of headaches. Allergies and sinus congestion can sometimes contribute to the development of tension headaches. Managing allergy symptoms with appropriate medications or avoiding allergens can help reduce the risk of headaches. Physical overexertion, such as intense exercise or heavy lifting, can sometimes trigger tension headaches, especially if it leads to muscle strain. Balancing activity levels and allowing time for rest and recovery can help prevent headaches. Exposure to loud or continuous noise can sometimes trigger or worsen tension headaches. Using earplugs or seeking quieter environments may help reduce the impact of noise on headache symptoms. Emotional upset, such as anger, sadness, or anxiety, can trigger tension headaches in some people. Developing healthy coping strategies for managing emotions can help reduce the frequency and severity of headaches. To summarize, tension headaches are characterized by a dull, aching pain that often feels like a tight band around the head. The pain is usually mild to moderate, affects both sides of the head, and is accompanied by muscle tenderness in the scalp, neck, and shoulders. Unlike migraines, tension headaches do not cause nausea, vomiting, or sensitivity to light and sound. Recognizing these common symptoms can help you identify tension headaches early and take steps to manage them effectively.